Nice to meet you, sir. Welcome. So, I'm from school. I'm a sports massage therapist. And today we're doing a brief consultation. I'll basically ask you a few questions about your medical history, your lifestyle history. We'll do run through a few tests, find out what your pain is, what's happening, and then I'll basically tell you what sort of treatment we'll do in our massage. So, what is your name for me, please?
Jacob Ray.
Right. And you are Mr., I'm guessing?
Yeah.
Yeah. What's your status?
Single.
Date of birth, for me, please?
3rd of February 2007.
And what's your occupation?
I'm a lifeguard / swim teacher.
So very active job, I'd say. So any children?
Nope.
Not yet. What's your height?
6'2".
6'2". And weight from
73 kilos.
And would you say your weight is gaining weight, losing weight, or steady?
Probably gaining weight.
So, have you had any previous accidents, surgeries, or operations like recently?
Nope.
No. And are you on any medication?
Nope.
No. So, pretty healthy individual. So, 1 to 10, how would you rate your general health?
Solid 9 to 10, I'd say.
9 to 10, that's perfect. On average, just average, how much alcohol do you consume?
0.
How much water per day do you reckon?
Probably 2 litres.
And on 1 to 10 again, your stress levels, like home, work, sports, like
Probably 2.
Would you say your diet is balanced? Would you say poor?
Probably balanced, very balanced.
Balanced. And are you on any supplements?
Creatine.
Do you have any allergies that I need to know of? Perfect. So nothing like oils or anything that we're using in our sports massage. Are you a smoker?
No.
Ex-smoker?
No.
Feel very healthy then. Your sleep pattern, you say it's average, irregular?
Very normal.
Very normal, average?
Yeah, average.
How many reckon hours per night on that?
Just probably 8 to 9.
8 to 9. Any sports and hobbies?
Swimming and gym.
Swimming gym. Interesting. Very active then, very active. How many hours do you reckon per week you're doing this?
Probably about 15.
15. So yeah, I'd say it's a very active lifestyle, I'd say. So I'm just going to run a few questions on your current medical history. So just answer yes or no. Do you have diabetes? Do you have high or low blood pressure?
No.
Very good. Do you have any heart, cardiac, circulatory problems?
No.
Do you have epilepsy?
No.
That's all right then. Do you have asthma or other respiratory problems that I need to know of? That's all right then. Do you have any digestive complaints like IBS, ulcers, reflux?
No.
That's all right then. Do you have any bowel or bladder dysfunctions that I need to know of? That's all right. No. So everything's no so far. Have you got don't have anything cancer? No. Do you have any menstrual problems?
No.
Do you have any type joint?
No.
So all of them are no, which is very healthy, good sign. So that puts us in a great position to move forward. Just any additional information, like have you had X-rays, MRI scans recently? No. Do you think there's any reason? I don't think there's any reason. Do you think there's any reason?
No.
Not. Well, advancing is. Right, very good. That's all the questions done. Now I'm going to ask you about your symptoms, what you're feeling, pain, like any tension in your body. So, any areas of your body that you're currently feeling pain or tension?
Probably my back, my traps.
Yeah.
My
The traps, muscle, the muscles. What, your shoulders as well?
Yeah, maybe a little bit of my shoulder.
Bit of shoulder,
yeah.
And we say what?
My
Whole of the
middle
back or?
Probably like my middle back.
Middle and upper back, you reckon?
Yeah.
So so middle to upper back, traps and shoulders. So like the higher upper portion of your axon, should we say? So yeah, so we say tightness and tension.
Yeah.
Or is it pain?
No, I'd say it's quite tight.
Tight. So that's probably from constant exercise.
Mm-hmm.
Maybe not getting necessary cool downs.
Yeah.
So what would you say the cause of it is? Exercise, or just everyday movements?
Probably just exercise for me.
From your hobbies, gym and something.
Yeah.
Perfect. So obviously your location, it's the back. Your typical average pain, what 1 to 10, what do you think is that like? resting phase.
Oh, like a 0.
Zero. So like no pain.
Yeah.
So like during exercise, that's when it's stimulated.
We go up to like a 5 during exercise.
5 or 6.
Yeah.
And then what about after exercise?
Go back down to like a 4 maybe.
Yeah. So I would say it's more happens during exercise and it comes back down. But when you're in normal everyday life, you don't really have any pain.
No.
So this type of pain, is it sharp pain? Is it prolonged pain? Is it soft pain?
It's quite, like I'd say, prolonged.
So long lasting. Perfect. And is there anything you like to do that relieves the pain? Like, is there any relieving factors?
Probably just relaxing, laying down.
And we'd say like stretching as well, like stretching up the back.
Yeah, stretching.
Obviously,
as well.
yeah, perfect. So I think carry on with that. Obviously, if that's helping you, carry on. But hopefully, their sports massage will help out as well. So, is there any factors that do aggravate it and make pain worse?
Probably back exercises.
Yeah,
It's
what,
more back.
Like in the gym and swimming.
Exactly.
Yeah. So, do you feel like you're working to your lifeguarding? Do you feel like that contributes to your work?
No.
Perfect, that's all then. And do you have any medication?
No.
Medication? No. Perfect, thank you. So, that's all good. At least you know what is happening. I'm just going to run you through a few tests if you'd like to stand up for me, please. Just take a walk, stay over there, I'll take a chair. So, just walk up and down. I'll have a look, how you want. Perfect, and walk back to me. Right, walk one more time. And again. See, you look pretty even. There's not very much like abnormality in your walk. Just stand aside and do a little plumb line test. Just make sure it's all in line. Perfect. So what I can see is your back and your upper portion is quite much abnormal to like your lower portion, which could mean a lot of tension, a lot of stress being put on. So hopefully during our sports massage, this will like make this much better.
Yeah.
So I'm just going to do a few movements just to test out your range of motion. So obviously it's your back exercise, but it may contribute to your shoulders as well. So if you stand shoulders by your side and go all the way up for me, please. So there's a lot of range of motion I can see in the back there. And go down. Perfect, perfect. And now, whatever arm you want to, so your dominant hand, I say start by the side and try and get as far over as possible. I can see, a lot of range of motion. Bit of tension there, would you say?
Yeah.
Perfect. So if you don't mind, I have it to say, I'm just going to start basically touching up and feeling your muscle with any tension. Is that right?
Yeah.
Perfect. So there's a lot of tension there, isn't there?
Yeah.
And more tension in your upper back, should we say. Perfect, perfect. I'm also going to do a few more movements just to test out like your everyday movement. So if you'd like, take and try and get up without using your hands if that's possible. Perfect, that's all good, that's all good. Right, that's all good, take it easy. So yeah, what I can see, it all looks good, and obviously from the movements we've done, I can see a lot of tension and stress in that upper back region and those shoulders. And obviously when I felt it, I could feel a lot of tension being put in there. So have you got any aims and objectives you want to get out of this?
Loosen up the back.
Like relieve the tension?
Yeah.
Yeah, so I think, yeah, exactly. Relieve stress, relieve the tension, try and help produce more stress-free and pain-free movement. So our treatment plans, what we're going to do, we're going to start with a bit of effluage, basically warm the muscles up, start with what's called fanning and what's called bimanual, basically just warm the muscle up, get you feeling more comfortable. We'll then go into some deep tissue massage, which basically will try and get further down into the muscle, relieve the tension and stress, and basically try and find some of those knots. After that, we'll do some petrissage, basically, which is basically lifting the muscle up off the bone, try and pick up that muscle, relieve the stress. We'll alternate between petrissage and deep tissue massage, and at the end, if you find knots, we'll go to trigger point therapy, which will relieve all the tension in your back, and then obviously we'll finish up with a bit of effluage. So, are you happy with that?
Yeah.
So, if you could just sign right on there, the patient signature. And I'll see you next time. Thank you very
Thank you very
much.
much.